On Morning News Now, we spent a lot of time talking about mental health. This morning, we're focusing on the mental health and trauma Black women in America face on a daily basis. In a new series for Shape magazine called The Mental Health Cost of Being a Black Woman in America, Chrissy King writes, quote, "It's time to take a look at the heavy load that Black women are carrying and how they're coping or struggling to with their circumstances, along with the beauty, the joy and resilience and the pride that they've managed to craft and nurture along the way." Chrissy King joins us now. She's a contributing editor of Shape's Digital Spotlight. Good to have you with us. So, I mean, just from that quote there I read in your piece, you explained the daily pressures on top of the mental burden that Black women face. What did you learn in writing this about Black women's mental health struggles?
Thank you for having me. I think, being able to contribute to these articles as well as read all the other articles in the piece is things I already knew, but also so many eye-opening statistics. One of them especially important is when we're talking about mental health care, and especially for Black women, it was staggering that only 4% of therapists in the United States are Black. And so when we're thinking about finding a therapist that's culturally competent, that's a huge barrier to access just to begin with.
Piece by saying, quote, "You've likely heard the phrase strong Black woman." Can you tell us more about this title, how it came about, and how you think it plays into mental well-being?
Absolutely. So this idea of a strong Black woman has been with us for a very long time, dating back to slavery. And when we think about it today, the impact of it is this idea that we as Black women have to have it all together, have to be resilient, have to be strong, have to take care of everyone else as a priority before ourselves. It prevents us from asking for help sometimes. And so it has a huge impact on mental health because in one way, we're taking care of everything. We're getting things done. And sometimes we're making it seem really easy. But on the backside, we are suffering with anxiety sometimes, depression, really struggling to keep it together behind the scenes and really struggling to ask for help when we need it.
This series also focuses on beauty standards and how that impacts someone's mental health. Your colleague, Tatiana Walk-Morris, spoke with one Black woman, Sydney Clark, who talked about how her mother and sister have lighter skin than her. She said, quote, "It's something that I dealt with for a long time, kind of wishing that I was whiter so I could fit in with my family. I was trying to understand why I ended up looking like this." That's the quote there. Talk to us about some of the Eurocentric beauty standards that Black women face and how its impact goes just beyond someone's appearance.
Absolutely. So when we're thinking about Eurocentric beauty standards, this idea that lighter skin is more attractive, straighter hair perhaps, wanting to have a thinner nose, a very particular body type. And as the woman in the article is speaking about, colorism within the Black community is a real issue, right? And so she, having darker skin than the rest of her family, felt like she wasn't as beautiful or wished that her body was different. And so when we're thinking about Eurocentric standards of beauty, it's this idea that we're always striving for something other than what we are. And of course, that has an impact on mental health because your body is what your body is, your skin color is your skin color, and this desire to be something else can really put a lot of mental angst on people, and also shows up in other ways. And we're thinking about Eurocentric standards of beauty, it also is not just us that feels that way, it's society at large that has a preference for certain types of looks, the Eurocentric looks in general. And so there can also be harmful impacts from not fitting into those standards in the workplace, with colleagues, and all types of things.
Chrissy, there's still a lot of stigma around reaching out for help, seeing a therapist, someone to talk to. You mentioned that staggering 4% number when it comes to therapists. Your series for Shape includes a story on the shame of therapy. Tell us more, and is this stigma changing?
Yeah, so unfortunately, there is still a lot of shame and stigma, particularly within the Black community around mental health. And if you read the piece on mental health talks about not feeling comfortable reaching out or having family members say, like, you don't need therapy, we can just pray on this. And so there definitely is still a lot of stigma around mental health in the Black community, but I do feel like that's beginning to change, especially for Black women. We think of notable Black women like Simone Biles and Naomi Osaka and even Lizzo talking about mental health and taking time and prioritizing their mental health. And so I think that stigma is slowly starting to change, and more Black women in particular are reaching out to get the help they need, because ideally we want to be thriving. We want to be not just surviving, but also thriving, and reaching out for a therapist can help us sort through some of those issues.
Chrissy King with Shape magazine, such an important series. Thanks so much for taking time to talk with us about it this morning.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.